Every year, around 200,000 people are hospitalized and 36,000 deaths occur in the United States due to the influenza virus, causing a localized viral respiratory tract infection. An influenza virus outbreak usually occurs in the winter season, with the peak usually occurring between the November and May months and lasts between 4 to 8 weeks if there's only one strain circulating around a community. The pathogenesis or development of the disease starts when an affected person talks, coughs, or sneezes large droplets greater than 5 micrometers, and the virus enters the mucosae of a new host, making the influenza virus a common airborne infection. Transmission can also occur by direct contact with virus-contaminated surfaces known as fomites and by shaking hands with the contaminated person. The incubation period of influenza is 2 days on average, but may range from 1 to 4 days in total. Aerosol transmission may occur 1 day before the onset of the symptoms, but the virus could be transmitted via asymptomatic people as well. The influenza virus is a member of the Otomyxoviridae family, which represents envelope viruses with a genome that consists of negative single-strand RNA segments. There are 4 types for this family, but only type A and B are clinically relevant for humans, and especially type A is a zoonosis which can affect other animals and is the primary reason why the genome of influenza A can change, has caused several pandemics such as the Spanish flu or the swine flu. Hemagglutinin and neuraminidase are proteins that surround the influenza virus and attacks the host. Neuraminidase degrades protective mucus and cleaves the virus loose to infect other cells, while hemagglutinin is responsible for binding cell surface receptors and allowing the virus to get in the cell where it replicates in the nucleus. The viral replication kills host cells, and the cycle continues, eventually triggering the innate immune system, which produces pro-inflammatory cytokines to combat the virus. The clinical signs of influenza virus is a rise in body temperature greater than 100.4 degrees Fahrenheit and occurs 1 to 3 days following infection. Other signs include nasal discharge, cough, tachycardia, red watery eyes, weakness, severe fatigue, sore throat, myalgias, or frontal or retroorbital headaches. Symptoms for patients with more complications includes otitis media, sinusitis, sepsis, or pneumonia from the virus or bacteria type pneumonia, which involves Staphylococcus aureus, Streptococcus pneumoniae, and Streptococcus pyogenesis. The CDC and American Academy of Pediatrics recommends that all people 6 months of age and older get a flu vaccine every year. This includes pregnant women. Healthcare providers advise getting a flu vaccine each year as soon as it's available in the area. Due to an antigenic drift which causes mutations in the genome of the virus, a yearly change in the flu vaccine is required. Frequent hand washing is a proven way to help prevent the spread of the infection. The use of an alcohol-based hand gel containing at least 60% alcohol may be used if soap is not available. Avoiding touching your eyes, nose, or mouth prevents spread of the infection. When possible, clean phones, computer keyboards, and toys, often with disinfectant wipes, and if possible, don't get close with others who have the flu or symptoms of the flu. Diagnosis includes clinical criteria or rapid diagnostic tests via a viral culture of the nasopharyngeal sample or throat samples of the patient. Treatment involves rest and intake of plenty of fluids to let the body fight the infection on its own. Over-the-counter anti-inflammatory pain relievers may help with symptoms, and sometimes healthcare providers prescribe antiviral drugs.